In the article Health, Wellness, and Well-Being by Max Holdsworth, Holdsworth describes to his audience that wellness and well-being and how they relate to health. Throughout the article, Holdsworth's main argument is that traditional health systems in the United States don't currently promote wellness, and that the national promotion campaigns and legislation can help change the way we view health by also including wellness and well-being. I do want to note that throughout his article, Holdsworth shares quotes from many credible sources, including the Oxford Dictionary, professors, different studies, and the Affordable Care Act, which all help strengthen his argument. Where Holdsworth referenced many credible sources, he provided direct quotes, studies, and statistics, which in turn helped strengthen the argument. So to start off, Holdsworth began by sharing that the Oxford Dictionary defines wellness as the state of being in good health and not just the absence of sickness. He compared that to well-being, which is defined as the state of being comfortable, healthy, or happy, where both of those definitions include some value of health. Professor Anna Kirkland shared that someone who's satisfying wellness is both living well and working towards the prevention of their own disease and disability. She noted that that differs from the traditional view of health, as it doesn't focus on curing any sort of ailment. Professors Diener and Chan did a study measuring well-being and its effect on health, and their study found qualitative positive effects of high well-being, representing that the subjective well-being does have some sort of impact on health. So Holdsworth explains how traditionally the term health just meant managing sickness. However, the terms well-being and wellness also have to do with health, but they include happiness too. So both Anna and Professors Diener and Chan seem to have a similar viewpoint as Holdsworth. So Holdsworth then goes on to discuss the traditional medical system, where he believes a common problem is that people are unable to get affordable access to basic medical care. And the traditional healthcare system is also focused primarily on keeping people from being sick. Doctors and service providers are currently being paid by the services they provide, not necessarily the wellness of their patients. And same with the payment systems and insurance markets. So neither of them are focusing on how well the patients are, they're just focusing on the sickness. However, there have been some pushes to change how we view health in the United States to incorporate well-being and wellness into the definition. So there are different health promotion campaigns. One Holdsworth shared was the ODPHP's Healthy People 2020, which helped bring attention to that living well, being happy, and being self-fulfilled are important to health. Wellness and well-being are also discussed within the Affordable Care Act, which helps show the objective of increasing healthcare coverage and living well for Americans. After the Affordable Care Act was enacted, corporations, including the Rand Corporation, found that when their employees participated in a wellness program at work, that it lowered the cost of medical care and healthcare usage, which showed that these programs in the workplace workers and employers can benefit from in terms of living well. So there's something called the State Innovation Model that also grants focus on payment reform, which represents a shift from medical to wellness emphasis at the state level. However, those changes are great, but there are some political boundaries preventing universal coverage. So the American Care Act is federal, where the act granted states funding to expand their Medicaid programs. However, there are some states choosing not to expand their programs. So where this is new attention being brought to the wellness side of health, it's likely to have positive effects on the well-being of people to get those benefits, but it might take some time for that to start happening. So overall, it really seems like Holdsworth was interested in the healthcare reform. The facts that he shares all seem to relate to including wellness in healthcare instead of just that traditional healthcare model of focusing on the absence of sickness. He shares that there are the boundaries that stand in the way of preventing wellness and well-being policies from becoming a law, many of which are political. However, in his conclusion, he describes that if politics can regain the healthcare and wellness agenda of the Affordable Care Act, then legislation might be able to provide healthcare to more Americans, which would in turn help more Americans get well and live well.